Good evening. Good evening, everyone. So today we will be discussing our oral and maxillofacial surgery topic, that is impactions. We will be discussing impactions today. Okay, so in this session, what we are going to do is, we are not going to go into the details since it's a 1-hour session. So what we are going to do is, we are going to just look at the very important exam questions that are usually asked from this topic. Okay, very important exam questions very quickly from this topic. So first of all, first thing that we will look into is order of impaction. Order of impactions. This is an important point, so please write down. It is mandibular third molar, followed by maxillary third molar, followed by maxillary canine, followed by mandibular second premolar, followed by mandibular canine, followed by maxillary premolar, followed by maxillary. Now this maxillary premolar can be anyone, either first or second, followed by supernumerary teeth, and followed by maxillary incisors. This is your order of impaction. And this is an important question as well. Now, the next thing we are going to see is classification of impaction. Now, we will specifically see classification of mandibular third molar impactions. Mandibular third molar impactions, we're going to specifically look at the classification of that. Okay. Mandibular third molar. Okay. Now the first thing is Winter's classification. Winter's classification. Okay, the first thing is Winter's classification. All right. First thing is Winter's classification. Now, based on angle, or based on it is also known as angular classification, because it is based on the angulation of the impacted third molar. All right, it is based on the angulation of impacted third molar in relation to long axis of mandibular second molar. Okay, now this will be mesioangular, vertical, horizontal. Please write down. Distoangular and inverted. Okay, distoangular and inverted. Horizontal is further subdivided into buccoangular and linguoangular. All right. Now, let us understand. We will draw this is the long axis of 7, and if we trace the long axis of 8, it is going mesial to the long axis of 7. Hence, this is mesioangular. Hence, this is mesioangular. Okay. Now, mesioangular is the most common and it is the easiest impaction. Okay, most common and easiest impaction is mesioangular, and distoangular is least common and difficult. Least common and difficult. Okay. So if there's any doubt, all right, if there's any doubt, you all can ask me in the comments. All right, we'll try to quickly finish the most important things that is asked from this topic in exams. Okay, now the second thing that we will do is Pell and Gregory classification. Pell and Gregory classification. Now this classification is important. I will tell you why, because when we are asked the scoring criteria, that is where this classification comes into play. Okay, तो ये classification important है. सबसे पहले इस classification के 4 components हैं. We will look at the first component, that is Ramus relation. Now I will give you a small tip. There is no need to mug up this classification. इस classification को रटने की जरूरत नहीं है. I will give you small diagrams. Just remember the diagrams. Have a pictorial memory. Okay, have a pictorial memory. I'm going to draw certain diagrams. बस वो diagrams याद रख लेना. You will be able to correlate if you are given an OPG in the exam, or if you are given any situation in the exam, you will be able to correlate it very easily. All right. So we will draw diagrams for the classification. And if you miss out on drawing the diagrams right now, you can come back to the recorded lecture later and complete your notes. All right. So we will draw the first diagram for class 1. Okay, we will draw the first diagram for class 1. Quickly, we will draw a diagram. In case you miss out on drawing the diagram, please come back to this later and अपना diagram complete कर लेना. Okay. Now this is our impacted tooth. Okay. Now we will look at 2 aspects. In Ramus relation, we will look at 2 aspects. ये जो मैंने draw किया line, I'll use a different color which will be more prominent. This line, please note, distal surface of second molar tooth पे I have drawn this line. All right. And one line I'm going to draw at the ascending border of ramus. One line at the ascending border of ramus. Okay. So if this is A, this width is A from the distal surface of the second molar till the ascending border of ramus, this is width A. And the width of the impacted molar tooth is B. I'm zooming in. The width of the impacted molar tooth is B. So A is greater than B. A is greater than B. That means there is sufficient space available for the tooth to erupt. There is sufficient space available for the tooth to erupt. Okay. So what is class A? We will quickly write down, and rest we will just see the diagrams. When space between distal surface of mandibular second molar, when space between distal surface of mandibular second molar and anterior or ramus, anterior or ascending border of ramus is sufficient to accommodate the mesodistal dimension of third molar. Okay, this is class A. When A is greater than B, that means when there is sufficient space between the second molar and the ascending border of ramus to accommodate the mesodistal dimension of the impacted third molar, this is class 1. Okay, now we will see class 2. Now we will not write down. That was just to make you understand. Class 2, we will just remember with a diagram. Please have a look here. मैं zoom out कर रही हूँ. This is A and this is B. This is A and this is B. Okay. So this becomes class 2, which is insufficient space. This class 2, which is insufficient space. Okay. Now we will have a look at class 3. We will have a look at class 3. Just carefully look at the class 3 diagram. There is no space for the third molar to erupt. There is no space for the third molar. Third molar कहाँ है? Ramus में पड़ा हुआ है. Third molar is lying inside the ramus, if you see. So what is class 3? No space. This is no space, and the tooth is in ramus. Okay, if you see the diagram, the tooth is in ramus. I'm enlarging this. Tooth is in ramus. Alright, fine. Tooth is in ramus. So now we will quickly go back and we will see that class 1 is the easiest, class 1 is the easiest, and class 3 is most difficult. Okay, class 3 is most difficult. Class 3 is most difficult. So this was the Ramus relationship. This was the Ramus relationship. Now the next component of Pell and Gregory classification is occlusal relationship. Occlusal relationship. Okay, again, we will not go into much details. We will see a diagram. We will see a diagram. Okay, we will see a diagram. We will see diagrams, okay? Just remember this diagram. Now please carefully look at the lines that I am drawing. Please look at the lines that I'm drawing. Okay. Carefully see, from the central fossa of 6 and 7, I have drawn a line, and that is the occlusal line. And from the CG of 6 and 7, I have drawn a line. Okay, from the CG of 6 and 7, I have drawn a line, and this is the cervical line. This is the cervical line. Okay. Now please see, when the highest point of impacted, please listen carefully, when the highest point of impacted third molar, when the highest point of impacted third molar is either at the occlusal line or above it, is either at the occlusal line or above it. Okay, this is position A. This is position B. Similarly, next thing, when the highest point of impacted third molar is between the occlusal line and cervical line, this becomes position B. This becomes position B. Okay. And when the highest point of the impacted third molar is below the cervical line, this becomes position C. This becomes position C. Okay. बस diagram याद रखना. You will be able to answer questions in your exam. All right. Just remember this diagram: position A, position B, position C. All right. Position A, position B, position C. Position A is when the highest point of the impacted third molar is present at or above the occlusal line. It becomes position A. Position B is when the highest point of impacted third molar is present in between the occlusal line and cervical line. It becomes position B. And when the highest point of the impacted third molar is below the cervical line, it becomes position C. Okay, this is your, now please remember, position A is easiest. we will write with a different color. You can use your different colors in your notes also. Please remember position A is the easiest. Okay, position A is the easiest and position C is most difficult. Okay, position C is most difficult. Easiest and most difficult. Okay. Now, the third component of Pell and Gregory classification is angulation. We have already seen this is the same as Winters classification. Okay. जो अभी सबसे पहले हमने देखी थी Winters classification according to the long axis, this is the same. Okay. And D is expected complications. Now, expected complications के details में जाने की जरूरत नहीं है because it does not form a part of the scoring index. So, the fourth component, if someone asks, those are expected complications. Now, there is another classification of impaction. There is another classification of impaction based on type of impaction. Based on type of impaction. Okay, based on type of impaction. So, it can be soft tissue impaction. It can be soft tissue impaction. It can be partial bony impaction. Okay. And it can be total bony impaction. Can be total bony impaction. Alright. So, classification में बस इतना ही required है. And सबसे important है Pell and Gregory classification. वो याद रखनी है. Alright. You have to remember that. Now, there is something known as radiological assessment of mandibular third molar. Radiological assessment of mandibular third molar. Now, there is something known as Winters lines. Again, मैं diagrams बनाऊंगी. Just remember the diagram. There is no need to take any stress on how to remember this. Try to remember the diagrams that I'm drawing over here. Make notes of this. This will also help you in quick revision on your last day. So this session I'm taking in a way that whenever you come back to the session, you don't need to open any books, any notes. You can just quickly go through this session of 1 hour and you can completely revise Impactions and be ready for your exam. So I'm taking this session in a way where you have only the most important points that are asked for from Impactions. Now, Winters lines को war lines भी बोला जाता है. They're also known as war lines. Now, let's see the first component, that is W, and it stands for white line. It stands for white line. Now, let's see what is the white line. Let's see what is the white line first. Let's see what is the white line. Now, we don't white, I'll not use a white pen. I'll use a gray pen for this. For white, I'll use a gray pen. Okay. Okay, I'm using a gray pen for white line because white won't be visible here. Okay, so this line is formed by joining the occlusal surface of the molars and extending it posteriorly over the third molar. Alright, this line is formed by joining the occlusal surface of molars, that is your second and first molars, and extending it posteriorly over the third molar. Okay, now what does this, सबसे इंपॉर्टेंट इसमें क्या पूछा जाता है, लाइन कहाँ से कहाँ जा रही है, यू विल रिमेंबर विद द हेल्प ऑफ अ डायग्राम. The most important thing that is asked from this aspect is what does a white line signify or what does a red line signify. So we will have to remember the interpretation, or we will have to remember the significance of all these lines. All right, so white line, what does it interpret? Interpretation of white line, it denotes the depth of impaction. It denotes the depth of impaction from occlusal plane. It denotes the depth of impaction from occlusal plane. All right, बहुत सिंपल है याद रखने के लिए. व्हाइट लाइन कहाँ से ड्रॉ करी, ऑक्लूशल सर्फेस से, तो डेप्थ कहाँ से बताएगा, फ्रॉम द ऑक्लूशल सर्फेस और फ्रॉम द ऑक्लूशल प्लेन. ऑलराइट, इट डिनोट्स द डेप्थ ऑफ इम्पैक्शन फ्रॉम ऑक्लूशल प्लेन. क्लियर? So the interpretation part is important, that you have to remember. Okay, now the next line that we have is A or amber line. A or amber line. Amber is nothing but your color orange. Alright, amber is nothing but your color orange. A is your amber line. Let's see what does this line denote. Okay, again we will draw a diagram. The small triangle that I have drawn, जो छोटा सा triangle बनाया बीच में, that is your interdental bone. That is your interdental bone. Now please have a look, how do we draw the amber line? Okay, this is your amber line. This is your amber line and यहाँ mark कर देते हैं, ये है interdental septum. This thing that I have drawn is your interdental septum. This is your interdental septum. All right, so this line, please listen carefully, this line is formed by joining the interdental bone between mandibular first and second molar and extending it posteriorly to the overlying bone of impacted third molar. Alright, तो बेसिकली हमने क्या किया, जो इंटरडेंटल बोन थी 6 और 7 के बीच में, वहां से एक लाइन ड्रॉ करी पोस्टीरियरली टुवर्ड्स द और over the bone that is covering your impacted third molar. All right, so ye, just have a look here. If you see, ये क्या signify कर रहा है, depth within bone. What is this signifying? Depth within bone. All right, it is signifying depth within bone. So interpretation, denotes depth of impaction within bone. Okay, this is the interpretation of amber line. The next we have R, that is red line. The next that we have is R, that is red line. Again, diagram yaad rakho, you will automatically remember in the class, in your exam. All right. Okay. Now we will draw all the lines in this one for you to understand also. ये हो गया आपका white line. तो white line कहाँ से था? From the occlusal surface. Okay. Amber line was from the interdental septum. Amber line was from the interdental septum. ठीक है. Now I will draw the red line first and then explain. I will draw the red line first and then explain. Now I am drawing one blue dot here. अब ये blue dot क्या है? Blue dot पे आपका point of application of elevator. You will apply your elevator at that blue dot. ठीक है. तो red line क्या है? Red line है that you will draw a perpendicular from the amber line to your point of application of elevator. You will draw a perpendicular line from amber line to the point of elevation of, to the point of application of elevator. All right, this is your red line. You will draw a perpendicular from the amber line to the point of application of elevator. This is your red line. So this last diagram में तीनों lines summarize हो गई हैं. All right, all lines have been summarized in this last diagram. Okay. Now interpretation of red line. Okay, interpretation of red line. Red line denotes depth of impaction. Please note, it denotes depth of impaction with reference to amber line within bone. ठीक है. So red line denotes the depth of impaction with reference to amber line. क्यों? क्योंकि हमने amber line से start किया है red line को draw करना. And amber line क्या था? हमारा bone का line था. White line was our occlusal line. Amber line was our bone line. So it denotes the depth of impaction with reference to the amber line within the bone. Okay, simple. You don't need to mug up what denotes. Just try to remember this diagram. If you will keep revising these diagrams, you will automatically remember in exam. All right. So this is the interpretation of red line. Now, two more points here. If red line is more than equal to 5 mm, if red line is more than equal to 5 mm, it is a difficult case and requires general anesthesia. All right. And more than equal to 9 mm, more than equal to 9 mm, it is a deep seated third molar. It is a deep seated third molar which is near the root apex, near the root apex of mandibular second molar, near the root apex of mandibular second molar. Okay, these are the another two additional points that you have to remember. Okay, now this completes your wall lines. This completes your wall lines. I want to now cover another very important topic that is also most commonly asked, that is relationship. That is your relationship of mandibular third molar to inferior alveolar canal. To your inferior alveolar canal. To your inferior alveolar canal. Okay. Now to understand this, first we have to appreciate the normal appearance of inferior alveolar canal. Normal appearance of inferior alveolar canal. ओके अगर आप inferior alveolar canal देखोगे किसी भी रेडियोग्राफ पे तो you will see two radiopaque lines with a radiolucent band in between. You will see two radiopaque lines with a radiolucent band in between. So this is superior cortical radiopacity. All right, and this is inferior cortical radio opacity. All right, and this is the radiolucent band. This is how your normal inferior alveolar canal looks like. Okay, now there are certain criterias. There are certain criterias and उनके नाम है different books पे different जगह different नाम दिए हुए हैं, but recently it is known as Rude's criteria. Rude's criteria. It was given by Rude and Shehab. Okay, it was given by Rude and Shehab. And older books में it is also known as Ho and Payton's criteria. This is in older books. Okay, this is in older books. So don't need to confuse if they interchangeably use the name either Rowe and Payton's or Rude and Shahab or just Rude's criteria. They mean one and the same thing. So please don't get confused. Okay. Now, please note these criteria indicate proximity or close relationship between inferior alveolar canal and mandibular third molars. Alright, these criteria indicate the closeness between or proximity between the inferior alveolar canal and mandibular third molar. Okay, now first of all, the first thing that we will see is criteria related to tooth. Criteria related to tooth. All right, the first thing that we have under this is darkening of root. The first thing that we have under this is darkening of root. Again, please, we will draw only diagrams so that you can remember with your pictorial memory. ऑलराइट, थ्योरी लिखने की, डिटेल में जाने की कोई ज़रूरत नहीं है. Just remember the diagrams that I'm giving you. It's going to be more than sufficient and you're going to answer well in your exam. Now, darkening of root से क्या मतलब है? If you see a normal radiograph, alright, how do we see the root? The root has cementum, it has dentine. So कैसा दिखता है? Complete root will be radio opaque. It will be radio opaque. Only the canal in between will be radiolucent. Only the canal in between will be radiolucent. Now what is happening in darkening of root? जो apical tip होगा root का, वो dark हो जाएगा. Alright, it will be dark. It will not be radio opaque. It will be dark black and it may be even more radiolucent than the canal. Alright, this is your darkening of root. This is your darkening of root. Please make the diagrams in the exact same manner as I am making them so that it is easier for you all to revise. Okay, this is darkening of root. Alright, now we will see the next criteria. Next criteria is bifid root apex, bifid root apex or apical notching, or apical notching. Again, I will draw a diagram for you all to understand this. I'm going to zoom out so that you can appreciate. Okay, if you will see carefully, there will be a very small notch at the apex, very small notch at the apex of the root. Alright, so the beach wala area, the area in the center is the apical notch. This is your apical notch. Okay, there will be a small indentation, small notch at the root apex. This is your apical notching. All right. Now the next criteria related to tooth is sudden deflection of root. Sudden deflection of root. Just draw the diagrams, more than sufficient. Okay. Sudden deflection of root. Root was, if you trace the root, सीधी जा रही थी, एपेक्स पे सडनली डिफ्लेक्ट हो गई. रूट एकदम सीधी जा रही थी और एपेक्स पे सडनली डिफ्लेक्ट हो गई. ऑलराइट, दिस इज सडन डिफ्लेक्शन ऑफ रूट. It was going in a nice formed manner till the apex, and suddenly at the apex there is a deflection of the root. Alright, this is sudden deflection of root. This is your inferior alveolar canal. Okay, now the next thing is criteria related to inferior alveolar canal. अभी जितने भी क्राइटेरिया हमने देखे थे, they were criteria related to tooth. Now we will see criteria related to inferior alveolar canal. Now the first criteria is absence of cortical outline of inferior alveolar canal. Absence of cortical outline of inferior alveolar canal. Now how there, जरूरी नहीं है कि कंप्लीटली जो कॉर्टिकल आउटलाइन हो कंप्लीटली एब्सेंट हो. क्या हो सकता है? हेजीनेस भी हो सकती है. ओके, डिक्रीज्ड डेंसिटी हो सकती है. ओके, पोरोसिटी हो सकती है. ऑलराइट, और या कैनाल्स के आसपास डिक्रीज्ड ट्रबैक्यूलेशंस हो सकते हैं. नेसेसरी डज नॉट मीन एब्सेंस, मीन्स इन लिटरल सेंस ऑफ एब्सेंस. वहाँ हेजीनेस हो सकती है, वहाँ कैनाल में कुछ ब्रेक या पोरोसिटीज हो सकती हैं, वहाँ कैनाल की जो रेडियो ओपेसिटी है वो डिक्रीज्ड हो सकती है. सो दैट वुड all of this will contribute to absence of cortical outline of inferior alveolar canal. All right, now let's see. Pehle I will draw one normal diagram and then to explain. Okay, this is, if you see carefully, both outlines are present. Okay, now if you want to note the absence or haziness, kaise dikhega, let's see that. इस एरिया में जहां पे मैंने कैनाल की कॉर्टिकल आउटलाइन मिसिंग बनाई है, दिस एरिया दैट आई एम पॉइंटिंग विद एरो, आइदर यहाँ पे कंप्लीट एब्सेंस होगा कैनाल का, या यहाँ हेजीनेस होगी, या यहाँ पे कैनाल की कॉर्टिकल आउटलाइन में ब्रेक होगा, या उसकी रेडियो ओपेसिटी एडजेसेंट एरिया से डिक्रीज्ड होगी. ऑलराइट, दैट इज एब्सेंस ऑफ cortical outline of canal. All right, now the second criteria related to inferior alveolar canal is sudden deflection of canal. Sudden deflection of canal. Related to criteria related to teeth में या tooth में क्या था? Sudden deflection of root. Criteria related to canal में there is sudden deflection of canal. All right. Normally canal is like this. If you see, there would be a sudden deflection of canal. Sudden deflection of canal is like this. All right. This is nothing but in simpler terms a sudden bend. कैनाल नॉर्मली चल रही थी बट एट वन पॉइंट जाके दोनों कॉर्टाइसिस में सडन बेंड है. दिस इज सडन बेंड. ओके, नाउ द थर्ड इज narrowing of canal. Narrowing of canal, that is also known as hourglass canal. Hourglass canal. Now please understand the difference between deflection of canal and narrowing of canal. You don't have to get confused nahi hona hai. Now if you see at any inferior alveolar canal, it will have a maintained width between the superior cortex and inferior cortical outline. All right, it will have a maintained width. Now what is happening? Due to this molar, there will be sudden dip, but only in the upper cortex. The lower cortex would be maintained. The lower cortex would be maintained. Okay, the lower cortex would be maintained. So what will happen as a result is, here and here the width would be more or less equal. Where I marked these first two arrows, here and here the width would be more or less equal, but where there is sudden narrowing, the width would have decreased. The width will be decreased. Okay, the width will be decreased. So please remember, in sudden deflection of canal, both the cortices will have a bend, and in narrowing of the canal, only the upper cortex will have a bend and the lower cortex would be maintained, but the width of the canal would be decreased. The width of the canal in that area would be decreased. All right, so this are your Rood and Shahab criteria. Now there are certain high risk criteria. Certain high risk criteria. Now darkening of root, Second one is absence of cortical outline of inferior alveolar canal, absence of cortical outline of inferior alveolar canal, and third is sudden deflection of canal. Sudden deflection of canal. Now please make a note. These are the high risk criteria. Now what do you mean by high risk criteria? अगर इन तीन क्राइटेरिया में से कोई दो प्रेजेंट है, that means your nerve is passing through the root. It is passing through the substance of the root. Alright? Please make a note of this at this point in your notes. Out of these high risk criteria, अगर तीन में से दो present है आपके radiograph पे, तो there is a high possibility that the nerve is passing from in between the substance of the root. Alright? Okay? Now we will see the difficulty index. We will see the difficulty index, alright, or difficulty indices in relation to third molar. We'll see difficulty index or indices with respect to third molar. Fine. Now the first one is Winter's classification cum difficulty index. Winter's classification cum difficulty index. So I have already told you this in the beginning of the session. Mesioangular is the easiest or simplest, and distoangular is the most difficult. Okay, this is easiest or simplest, or distoangular. Mesioangular is the easiest or simplest, and distoangular is the most difficult. Now the second one is Pell and Gregory. जो क्लासिफिकेशन अभी जस्ट पढ़ी थी, Pell and Gregory classification cum difficulty index. Now what all did we study in Pell and Gregory? First thing we studied was the Ramus relationship, which was class 1, class 2, class 3. And the second thing we studied was the occlusal relationship, that was position A, position B, and position C. Okay. What was? एक काम करते हैं, quickly revise कर लेते हैं what was class 1, class 2, and class 3. So class 1 was when there is sufficient space present between the distal surface of the second molar and anterior border of ramus to accommodate the mesodistal dimension of the third molar. That is class 1. Class 2 is insufficient space, and class 3 is no space or when the tooth is completely in ramus. Okay, I am again and again stressing on the fact that please remember only the diagrams. It will be easier for you to recall. Okay, so class 1 is the easiest, and class 3 is the most difficult, and class 2 is intermediate. Okay, now occlusal relationship. This is position A, position B, position C. Right, this is position A, position B, position C. Now quickly we will revise position A, position B, position C. जब हम occlusal relationship देखते हैं तो we draw two lines. One is at the level of the occlusal plane from the central fossa, and the second line is the cervical line, that is from the cervical area. Okay. Now position A is when the highest point of the impacted third molar is at or above the occlusal plane. Position B is when the highest point is between the occlusal line and the cervical line, and position C is when the highest point is below the cervical line. Okay, so position A becomes easiest, position B is intermediate, and position C is most difficult. Position C is most difficult. Please remember your diagrams. Today after the session you can also go and quickly revise your diagrams. Okay, now the most important one, and जिससे questions बहुत बारी पूछे जाते हैं. If I look at last 2 to 3 years, every year there is one question from this particular index, and this is nothing but your Pederson's difficulty index. This is your Pederson's difficulty index. This is your Pederson's difficulty index. Now, Pederson's difficulty index uses, or it combines, Winter's classification cum difficulty index and your Pell and Gregory classification cum difficulty index. Pederson ने क्या किया, दोनों classifications cum difficulty index को उठाया और उन्हें combine कर दिया, क्लब कर दिया. Now, Winter's classification में हमारे पास क्या था? We had angulation. Okay, now let us see. Mesioangular, horizontal, vertical, distoangular. Okay, now Pederson difficulty index में क्या added चीज है, वो ये है कि Pederson difficulty index में उसने difficulty कैसे बताया, उसने score कर दिया. He gave a scoring criteria. He said that Winter and Pell and Gregory gave a difficulty index, but they very vaguely mentioned that this is most difficult, this is easiest, but there is no scoring criteria. So what Pederson did is he combined both the systems and gave a scoring criteria. We will just now have a look at that. Okay. Plus Pell and Gregory classification. अब इसमें first component was your Ramus relation, and this is nothing but your class 1, class 2, class 3, and the next is occlusal relation. Alright, that is nothing but your position A, position B, and position C. Now let's see his scoring criteria. To mesioangular, he gave a scoring criteria of 1. Scoring criteria of 1. To horizontal, he gave a scoring criteria of 2. To vertical, he gave a scoring criteria of 3. And to distoangular, he gave a scoring criteria of 4. Okay. Now, in Ramus relation to class 1, he gave a scoring criteria of 1. To class 2, he gave a scoring criteria of 2. And to class 3, he gave a scoring criteria of 3. Similarly, for position A, he gave a scoring criteria of 1. To position B, he gave a scoring criteria of 2, and to position C, he gave a scoring criteria of 3. Now, what is the calculation? Now what is the calculation? So calculation becomes your angulation plus angulation plus Ramus relation plus occlusal relation. Okay. When you add up all of this, that gives you your final scoring criteria. Now इसका इंटरप्रिटेशन कैसे करते हैं? टोटल स्कोर okay. Now if you see the lowest score can be 3. Okay, lowest score can be 3 and the highest score can be 10. Lowest score can be 3 and the highest score can be 10. Now 3 to 4, 5 to 6, 3 to 4, 5 to 6 and 7 to 10. 3 to 4, 5 to 6 and 7 to 10. 3 to 4 is easy or minimally difficult. 3 to 4 is easy or minimally difficult. 4 to 6 is 5 to 6, sorry, moderately difficult. And 7 to 10 is extremely difficult. Seven to 10 is extremely difficult. Okay? 7 to 10 is extremely difficult. Alright, so that was your Pederson's difficulty index. That was your Pederson's difficulty index. Alright, now there is something known as Wolff's assessment, which is also part of the difficulty index, but हमें details में नहीं जाना है. This I am telling here because there is a Wolff's assessment. तो Wolff में हर एक initial है that stands for something or that signifies something, but in some books one or the two initials are incorrectly mentioned. So W stands for Winter's classification. W stands for Winter's classification. H stands for height of mandible. H stands for height of mandible. So this, how is this noted? From interdental septum or interdental bone between second and third molar to lower border of mandible. Okay. A is angulation of second molar. Our books में it's mentioned as third molar. No, it is not third molar. Please mark this, that wherever it is given as angulation of third molar, you have to correct this point. It is not angulation of third molar, it is angulation of second molar. Please remember and please mark the correct answer. R is root shape and development. F is follicular size. And E is exit path. बस initials याद रखने हैं for your exam. Alright, you just have to remember the initials. What does Wolff assessment stand for? And there is one correction that I have told you. Please keep that in mind and kindly go with the correct answer. Alright, kindly go with the correct answer. Okay, now just one last thing before we finish this topic of impaction. Again, एक ऐसा point जिसमें से questions पूछे जाते हैं. There is something known as Bowdler Henry technique. Again, important question, important topic. Bowdler Henry technique, also known as lateral trepanation. Lateral trepanation technique. Lateral trepanation technique. Okay. Also known as prophylactic odontectomy. Prophylactic odontectomy. Okay. Now, what are we doing in this? What are we doing in this? That the mandibular third molars. Mandibular third molars सबसे last develop करते हैं. ठीक है. So it is why it is known as prophylactic odontectomy. That is because we are extracting the third molars in its developmental stages. That means what is developmental stages? When its root has not been completed yet. Root has not been completed. Now, why? There are some authors of the school of thought that if we remove the third molars in their developmental stage or prophylactically, so there will be more space in the jaws available and there will be less crowding in the anterior teeth. There will be less crowding in the anterior teeth. Although everyone does not believe in this concept, but some authors do believe in this concept that we should remove the third molars before they cause any further harm to the patient, and we should remove them in its developmental stages. We should remove them in its developmental stages. Now, please write down, there are just 2 points. All right. The 2 points are removal of third molar during its developmental stage. Removal of third molar during its developmental stage. Now, ideal time. Ideal time. When they should be removed? They should be removed. They should be removed when root of mandibular third molar is half to 2/3 formed. Half to 2/3 formed. Alright, this is according to Laskin. It should be removed when half to 2/3 formed. Acha, if in options there is half भी दिया हुआ है, 2/3 भी दिया हुआ है, please prefer 2/3 over half. Please prefer 2/3 over half. कई बारी ऐसा होता है options में, and many students have this doubt. I am clearing this doubt. If half is given in a separate option, 2/3 is given in a separate option, please mark 2/3 as your answer. Please mark 2/3 as your answer. All right. Now, with that, we will end our session. All right. So, in this session, I have tried to cover those topics which short form a question. Okay. I really hope that all of you found this session extremely helpful. And I have tried to, formulate the session in a way that whenever you just come to the session and you quickly go through this session, at least the very important points from Impactions are covered and you can quickly revise either before going to an exam, or either if you are traveling, or if you are, if you just want to have a quick video revision, you can quickly complete the important short exam point of view questions from this session. If there is anything else, if you would like us to, change the way we are taking these sessions, or if you want to give your suggestions and feedback, you people are most welcome. You can suggest us topics also for next sessions. You can suggest us the pattern, or you can suggest us whatever you want to cover, or if you want any changes that you want in the session. So wishing all of you all the very best, and we'll meet you soon with the next session. Thank you.